By the age of 50, approximately half of men will suffer from male pattern hair loss. For some, the thought of hair loss or going bald is distressing and can affect their self-esteem. In this week's video, we'll review why male pattern hair loss occurs, plus what are the best treatments available. So I pour up inside my cup and I just sip till I can't feel it. My name is Dr. Hart Pinto. At JHP Medical, we make weekly information videos designed to increase your awareness and to help you better understand your medical condition. So if you find this video helpful, subscribe, click the notification bell and the like button to support us in helping you. Okay, so what is male pattern hair loss? Male pattern hair loss is a condition known as androgenic alopecia and is the most common cause of hair loss in men. This condition is believed to occur due to the complex interplay of the potent male hormone dihydrotestosterone, DHT, and your genetic makeup. The hormone DHT causes progressive change in the hair follicles. Initially, this makes your hair thinner and lighter in colour. Follicles will eventually stop producing hair. As already mentioned, the condition has a genetic link, meaning if you have an affected family member, either on your mother or father's side, you're at increased risk for developing this condition. Unfortunately, the hair loss caused by androgenic alopecia is permanent. Are there any other causes of hair loss? There are many different causes for temporary hair loss, including stress, weight loss, iron deficiency, illness, and during cancer treatments. Naturally, we lose somewhere between 50 and 100 hairs per day, and that's normal, and this usually happens without us noticing. So what does male pattern hair loss look like? In this condition, men usually start to notice a receding hairline around the time of puberty. That's when the DHT hormone kicks in. The typical pattern is a receding frontal hairline and loss of hair at the top of your head. In affected areas, hairs are notably shorter and thinner than non-affected areas. The scalp, however, should look nice and healthy. How do I know if I have male pattern hair loss? Speak with your doctor. Doctors will base their diagnosis on the hair loss pattern you present with and your family history. So, I have male pattern hair loss, what can I do? Treatments are available, which can slow down your hair loss and even restore some of the lost hair. They come as topical treatments, i.e. ones applied directly to the scalp, and oral medications. 5% minoxidil. This treatment comes as a liquid or a foam which is applied directly to your scalp. In the initial weeks, this medication may promote hair loss before the new hairs start to grow. Usually treatment needs to be continued for at least 6 months before any benefit is seen. Fortunately, this treatment is well tolerated. However, some individuals will develop localized scalp reactions such as itching, dryness, and redness. Finasteride. Finasteride is an oral medication that helps to reduce the male hormone DHT. A reduction in DHT will reduce hair loss and promote regrowth of hair. The licensed dose of finasteride for hair loss is 1 mg taken once a day. Again, medication must be continued for at least 6 months for patients to see a benefit. Unfortunately, the effects of this medication will be lost 6 to 12 months after stopping any treatment. Therefore, you may need to commit to this medication long term. Reducing the male hormone DHT can have a knock-on effect, leading to reduced libido and erectile dysfunction. What about surgical treatments? Surgical treatments are available and take one of two forms. Hair transplantation, where hair follicles are harvested from more dense areas of the scalp and moved to the balding areas. Or scalp reduction. This is where the bald areas are surgically removed and hair-rich scalp is stretched over to provide adequate coverage. Both methods do not increase the number of available hair follicles. Effectively, these techniques promote a redistribution of the remaining hair follicles. Skin camouflage. These commonly come as pigmented fibres which help disguise your hair loss. Many different variations are available commercially. Unfortunately, products can fall away should your hair get wet, and they often don't last a very long time. Wigs. Wigs, toupees and hairpieces are effective methods of covering bald areas. These are available in both synthetic and real human hair options. And finally, why not just embrace being bald? Many men worry about the social stigma of being bald. Those who choose to shave their heads often report a sense of relief and even the sensation of their insecurities melting away. Recent studies have suggested that women can find bald men more attractive. Additionally, shaving your head will result in significant cost savings. Treatments for hair loss aren't cheap, and your wallet will thank you for this decision. Of course, this choice isn't going to be for everyone. Okay, so what about my prognosis? Male pattern hair loss affects everyone differently. The severity of your condition is influenced by a complex interplay of our genetic makeup and the amount of male hormones. I hope you've enjoyed this video. Don't forget to subscribe and interact by giving us a thumbs up or leaving a comment down below. This supports the growth of our channel and helps us educate many more people about their medical conditions. Of course, this video does not provide individual medical advice and is intended for information purposes only. Do not consider this as a substitute for professional medical advice, diagnosis or treatment. Please do not ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance service. Thank you for watching. See you next time.
One more sipping, I'ma fix it. Out my body when I'm tempted. I told her one more, she hit me say you quit or she dipping.